My name is Nathan Mermilliod. I live in Riverside, California, and I have severe hemophilia B. Hemophilia is a bleeding disorder, and it means that my blood doesn't clot properly. It takes longer for my body to form clots than a normal person, and that leads to injuries that are more severe and potentially spontaneous bleeding. I'm missing one of the components of my blood, specifically factor 9 of the 13 factors, which are proteins, and I have to take a medication to form clots in a timely manner. There are different severities of hemophilia, severe, moderate, and mild. Me having severe hemophilia means that I have less than 1% of factor 9 in my blood. Someone with moderate hemophilia would have about 5%, and someone with mild may have over 30% and may only have to treat in the event of a surgery or an injury. Some people imagine hemophiliacs gush blood after an injury, but that's just not the case. My bleeding is very normal, it just lasts longer, it's harder to stop. People with hemophilia and other bleeding disorders get diagnosed at many different ages, but it's very common if you have a severe form of a bleeding disorder to be diagnosed very, very early on in life. I was diagnosed at 3 weeks old, and I started prophylactic treatment, which means preventative factor replacement therapy, pretty much as early as they could access my veins, 1 month, 2 months old. I started out bi-weekly, and as factor treatment and products improved, I was able to transition to a 1-week regimen. And I will be on prophylactic treatment the rest of my life, whether it's factor replacement therapy or any novel therapies. I rely on this treatment. I need it to live. When I was a kid, I wanted to be as active as possible. I played baseball for a short time, but that required a lot of precautions, such as infusions every other day, more than my once-a-week schedule. I had to wear ankle braces and wear crutches from time to time because my ankles, my joints, bled frequently. Bleeds can be internal. In fact, they mostly are. Any bruise that you get on your body is a bleed. For me, I get lots of bruises. That's just a natural byproduct of having a bleeding disorder. Right now, I appear very normal, and that's only because of great treatment, but the treatment itself is extremely expensive. Many people have copays. Many people have large deductibles. There are many who struggle to afford access to care. It can lead to skipping doses. It can lead to postponing surgeries. It's a huge, huge problem. So I want to give back to the community. The bleeding disorders community has been so influential in my life in terms of helping me understand my disorder and helping me learn to live with it. I want to help others do the same. And I've recently applied to med school with the hopes of becoming a hematologist-oncologist. And I feel that as a hematologist, I can help patients on the front lines and help people who are newly diagnosed with hemophilia learn how to manage it and learn how to advocate for themselves. I don't like to envision my hemophilia as the enemy or something that I have to fight against. Much rather, I like to think about it as something that I work with, something I walk alongside in my life. My name is Nathan, and I live with severe hemophilia.